Sri Lanka stepped into a world of hurt when it rejected a shipment of organic fertilizer from China, saying the Chinese fertilizer contains dangerous bacteria. Here are the details. The BBC reports that Sri Lanka has sparked a diplomatic tussle with China by banning a shipment of Chinese organic fertilizer and ordering the shipment to be returned to China. The tussle started after the Sri Lankan government suddenly banned chemical fertilizers for health reasons in May and allowed only organic fertilizers to be imported. The government later banned the shipment of 20,000 tons of organic fertilizer from Chinese biotech company Qingdao Seawin Bio-tech, saying that testing found a dangerous bacteria in the organic fertilizer. The Sri Lankan government also ordered state-owned People's Bank to stop a payment of $9 million for the cargo. The Chinese embassy in Sri Lanka responded by blacklisting the bank for not honoring the payment. Meanwhile, the Chinese company rejected the testing authorities' test results and refused to take back the cargo, leaving the ship anchored off the coast of Sri Lanka. Sri Lankan farmers are protesting their government's handling of the situation, saying the resulting fertilizer shortage will lead to a much reduced harvest. Sri Lankan officials say the Chinese fertilizer contains bacteria that are harmful to certain crops. They insist that since the cargo has implications for the biosecurity of the country, it cannot be accepted. Scientists have discovered the cause of a mysterious illness that turns bald eagles into zombies before they die. Here is what they found. In 1994, dozens of bald eagles died in Arkansas. Before they died, they displayed signs of neurological impairment, including crashing into objects such as trees and cliffs. Necropsies found these birds had distinct lesions and holes that made their brains look like sponges, as if they had been eaten from the inside. Eventually, it was determined that these bald eagles, and in the ensuing years dozens of others from Texas to the Carolinas, had caught the illness from the water birds they preyed on, that often displayed similar zombie-like behavior. The condition is known as avian vacuolar myelinopathy, or AVM. Lab analysis showed that the eagle's prey had ingested large amounts of the invasive plant Hydrilla verticillata, also known as water thyme. By 2014, researchers at the University of Georgia had shown that a species of cyanobacteria that grows on the plant was responsible for AVM. They named the bacteria Atochthonos hydrilla, or eagle killer, that lives on hydrilla. However, when researchers fed eagles lab-grown A. hydrilla, the eagles did not get sick. Now, in a new study published in the journal Science, scientists at the University of Georgia, Germany, and the Czech Republic have identified the source of the neurotoxin. The bacteria only produce it when they come into contact with bromide. In their paper, the researchers say further investigation is needed to determine where the bromide is coming from. But there are some clues. All of the lakes where the eagles of AVM died were man-made, and bromide is found in some herbicides used to control infestations of Hydrilla verticillata. An explosion of black fungus infections hit India this year as COVID-19 infections left patients vulnerable to the effects of the fungus, officially known as mucormycosis. The U.S. is now experiencing its own fungal spread, with COVID-19 again cited as a factor. Here's what you need to know. A deadly fungus known as Candida auris has been spreading through nursing homes and hospitals across the United States, and in 5 cases has proven entirely resistant to all existing antifungal medication, according to the New York Times. The fungus is a form of yeast that is dangerous to hospital and nursing home patients with existing medical problems. The New York Times reports that between 5 and 10% of those carrying it develop more serious infections. Once it enters the body, as opposed to sitting on the skin, the U.S. Centers for Disease Control and Prevention says 1 in 3 patients with invasive infections die, although it adds that these people are usually already seriously ill. Since 2013, more than 2,000 Americans have been identified as being colonized by Candida auris, but in a major development on Thursday, the CDC announced that 5 patients in Washington, D.C. and Texas had infections that did not respond to any of the 3 major classes of antifungal medication. The Associated Press reports that the treatment-resistant fungus has spread in healthcare facilities through contact or via contaminated surfaces, and the New York Times explains that COVID-19 has likely helped accelerate this spread. Shortages of personal protective equipment caused by the pandemic and high numbers of people using ventilators could be key factors in the fungus's proliferation, with patients who have lines or tubes entering their body carrying the highest risk of infection, according to the CDC. Of the 5 people who were fully resistant to treatment, 3 died. In that context, the New York Times emphasizes 2 aspects of the story that are most concerning. Firstly, the fungus is increasing resistance to medication. The kind of resistance to medication that was reported by the CDC on Thursday has previously been reported in 3 patients in New York. However, those patients had already received antifungal drugs, where the recent patients had not. The crucial difference is that in the previous cases, scientists concluded the resistance to the drugs formed during treatment, according to the Associated Press, whereas here, the fungus arrived in the patient's bodies already resistant to the drugs. According to the CDC, each year in the US, at least 2.8 million people are infected with antibiotic-resistant bacteria or fungi, and more than 35,000 people die as a result. The New York Times characterizes this as a sobering reminder about the threats posed by antimicrobial resistance from superbugs like MRSA to antibiotic-resistant Salmonella. But it also emphasizes one key human factor in promoting this resistance. Nursing homes and long-term hospitals operate as a weak link in the U.S. healthcare system, it explains, because they are often understaffed and do not have the equipment required to pursue rigorous infection control measures. Furthermore, infected patients move freely back and forth between these facilities and acute care hospitals. They are cauldrons that are constantly seeding and reseeding hospitals with increasingly dangerous bacteria, according to one former lieutenant governor of New York, who now leads the nonprofit committee to reduce infection deaths. "You'll never protect hospital patients until the nursing homes are forced to clean up," she said. Yet, the opposite appears to be happening. According to the New York Times, skilled nursing homes and long-term care facilities are taking in an increasing number of patients who previously would have been in hospitals instead. There are now about 400 long-term care hospitals across the country, up from about 40 in the early 1980s, according to the New York Times, citing a study by the National Bureau of Economic Research. Changes in Medicare reimbursement rates have created a financial incentive for this expansion, it says. Additionally, according to the Centers for Medicare and Medicaid Services, cited by the New York Times since 2012, the number of these skilled nursing homes with ventilator units rose to 436 from 367. With patients using ventilators bringing in extra revenue, the cause of that increase is clear, but the capacity to increase profits has not been matched by better staffing. The Centers for Medicare and Medicaid Services gave over 1,400 nursing homes across the U.S. a 1-star rating for staffing in 2018. Clearly, there are a wide variety of factors involved in this story. A lack of antifungal drugs being produced is another huge discussion point that could be opened out. But questions should clearly be asked about the role of nursing homes in the spread of this fungus, and about the system behind those nursing homes that incentivizes bad practice. Never mind the chronic lack of development of new antimicrobial drugs under the current funding model. Turkey has been hit by a plague of sea snot that is covering much of its Sea of Marmara with a thick layer of mucus-like sludge. A sludge that looks like it's fresh out of the nose of some virus-ridden giant. Or make that the noses of a billion virus-ridden giants, as each of the slime spots cover many miles of the sea. And the gunk isn't just gross, it's also smothering animals underwater. Here are the details. The BBC reports that Turkey's President Erdogan has promised to save the country's shores from sea snot that has been building up in its waters. A thick, slimy layer of the mucus-like matter is spreading over the Sea of Marmara near Istanbul, damaging marine life and the fishing industry. This sea snot, or marine mucilage, is a naturally occurring green or white sludge that forms when algae is overloaded with nutrients as a result of hot weather and water pollution. Turkey's recent outbreak over large areas of the Sea of Marmara is believed to be the biggest in history and is causing havoc for local communities. Some fishermen are being prevented from working as it clogs up their motors and nets. President Erdogan blamed untreated sewage being dumped into the sea, as well as rising temperatures, and urged officials to investigate. His government has dispatched a 300-strong team to inspect potential sources of pollution. Divers have reported that large numbers of fish and other species are dying from suffocation. Researchers from the Turkish Marine Research Foundation warned such problems would continue unless there is fresh investment to treat and purify wastewater being pumped out of Istanbul. The foundation called it a real catastrophe and warned that, due to the overgrowth of the mucilage, several species are under threat, including oysters, mussels, and sea stars.
For more news animations and explainers, hit the subscribe and bell button to join the TomoNews family. Thanks for watching.